Medical marijuana is being implemented into healthcare plans rapidly throughout the nation. Currently, 23 states and Washington, D.C. allow for patients to be prescribed marijuana to help with illnesses, Illinois recently included. I sat down with Dr. Banhu Vankalanka from Mid-Illinois Hematology and Oncology here in Normal. Dr. Vankalanka explains what illnesses it is typically used for.
By and large, there are probably about 3 indications that we use medical marijuana for at this point of time. At least in our practice with cancer-related problems, we typically tend to reserve it for patients who have protracted nausea and vomiting, which is not getting under control with conventional anti-nausea medications. We also tend to use the drug for patients who have a poor appetite, who are losing weight, who are not receiving any significant benefit from nutritional intervention. The other set of circumstances in which it could be used is in patients who might have problems with muscle spasticity. And it is much more commonly used in neurological practices where patients might have, say, something like multiple sclerosis, or they might have other medical problems which cause a significant spasm of the muscle, chronic spasms of the muscle, which in turn result in chronic pain. And in those patients, it has been found that medical marijuana might be of some benefit.
While medical marijuana can alleviate some symptoms of illnesses, like any medication, there are risks of side effects. Reports included feelings of lethargy, dizziness, and dependency in the clinical trials. Dr. Vankalanka mentioned that studies were still being done, and while the short-term results seem to be positive, the long-term results are still being tested. At this time, and for what medical marijuana is being used for, Dr. Vankalanka wasn't too concerned about the long-term effects, as many of his patients being prescribed had incurable terminal cancers. I asked Dr. Vankalanka how the medical marijuana was being prescribed.
What they have done was to take away some of these chemicals that could have contributed to these side effects, particularly the dependency driving chemicals in the marijuana plant have been taken out, and then they came up with some kind of a synthetic formulation, and that is available in the form of a pill that we used to routinely prescribe, that we continue to routinely prescribe to our patients, and which is a cannabis derivative, not supposed to have the same level of addictive potential as natural marijuana. So when you do these cannabinoids in the form of medical prescriptions, you do it in the form of pills, okay, mostly. But if you are doing medical marijuana, marijuana is, being purchased as a plant product directly, and they go to the states, buy whatever plant products, maybe dried buds, leaves, stalks, whatever. And then they come and then they try and smoke it in order to derive the benefits from the drug. So we don't actually prescribe it in the form of a pill if it is medical marijuana.
Illinois is still in its early stages, with dispensary applications just recently becoming available. For now, patients would have to travel to other states to fill their prescriptions. Dr. Vankalanka's statements reflect his own personal knowledge and experience with medical marijuana. The Community Cancer Center and local hospitals have not yet put into place any policies for medical marijuana, but maybe within the next few years, patients can seek comfort in their own state. Reporting for WZND, I'm Melissa Williams.